Sam Vaknin's work has produced several profound insights into the fields of narcissism, personality disorders, and their psychological impacts. Here are 5 of his most influential contributions. Narcissistic abuse and complex post-traumatic stress disorder. Vaknin was one of the first to link narcissistic abuse with the development of complex post-traumatic stress disorder. He demonstrated that the prolonged psychological abuse experienced in relationships with narcissists can result in severe, chronic trauma, similar to that observed in victims of prolonged physical abuse. Cold therapy. Vaknin developed cold therapy, a treatment modality for narcissism and depression. This approach treats pathological narcissism as a form of complex post-traumatic stress disorder and focuses on re-traumatization and reframing to address the deep-seated trauma and emotional deficits in individuals with narcissistic personality disorder. Dual Mothership Concept. Vaknin introduced the concept of dual mothership, where narcissists and their intimate partners view each other as idealized maternal figures in a shared fantasy. This insight helps explain the dynamics of narcissistic relationships and the reenactment of early childhood dynamics between partners. Narcissism as an addiction. He characterized narcissism as an addiction to narcissistic supply, where narcissists depend on external validation and admiration to maintain their self-esteem and sense of identity. This addictive behavior can lead to a cycle of abuse and dependency in relationships. Pathological narcissism and societal impact. Vaknin argued that pathological narcissists often occupy influential positions in society, such as in medicine, finance, and politics. He suggested that these individuals contribute to a culture of collective narcissism, where societal values and norms are increasingly shaped by narcissistic tendencies. These insights have significantly influenced the understanding and treatment of narcissistic personality disorder and its effects on individuals and society. Narcissistic abuse and complex post-traumatic stress disorder. Narcissistic abuse, a term that has gained recognition largely through the pioneering work of Sam Vaknin, describes the severe emotional and psychological maltreatment inflicted by individuals with narcissistic personality disorder, NPD. Vaknin's critical insight into the correlation between narcissistic abuse and complex post-traumatic stress disorder has shed light on the profound and lasting impact this form of abuse has on victims. Understanding narcissistic abuse. Narcissistic abuse involves a pattern of manipulative, controlling, and exploitative behaviors that narcissists use to dominate and demean their victims. Narcissists seek narcissistic supply constant validation and admiration from others to bolster their fragile self-esteem. When their needs are not met, they often resort to tactics like gaslighting, emotional manipulation, and intermittent reinforcement to maintain control. This relentless cycle of abuse erodes the victim's sense of self, leading to significant psychological distress. The connection to complex post-traumatic stress disorder. Vaknin's assertion that narcissistic abuse can lead to complex post-traumatic stress disorder was groundbreaking. Complex post-traumatic stress disorder differs from post-traumatic stress disorder in that it arises from chronic long-term exposure to traumatic situations, such as sustained emotional or psychological abuse, rather than a single traumatic event. Symptoms of complex post-traumatic stress disorder include emotional dysregulation, dissociation, persistent negative self-perception, difficulty in relationships, and a pervasive sense of hopelessness. Vaknin's work emphasized that victims of narcissistic abuse often exhibit these symptoms due to the protracted nature of their trauma. The manipulative behaviors of narcissists characterized by cycles of idealization and devaluation, create an environment of constant psychological instability, leaving victims in a state of chronic stress and emotional turmoil. Mechanisms of trauma. The mechanisms through which narcissistic abuse leads to complex post-traumatic stress disorder are complex. Vaknin highlighted several key factors. Gaslighting. This manipulation tactic makes victims doubt their own reality, leading to confusion, anxiety, and a distorted sense of self. Intermittent reinforcement. By alternating between affection and abuse, narcissists keep their victims off balance, fostering dependency and deep emotional scars. Isolation. Narcissists often isolate their victims from friends and family, depriving them of support and making them more susceptible to manipulation and control. These tactics not only undermine the victim's mental health, but also disrupt their ability to form healthy relationships and maintain a stable sense of identity. Vaknin's contribution to understanding and treatment. Vaknin's insights have been crucial in the development of therapeutic approaches for victims of narcissistic abuse. His work has informed the creation of treatment modalities that address the specific needs of these individuals, focusing on rebuilding their sense of self and helping them recover from the deep psychological wounds inflicted by long-term abuse. One of Vaknin's significant contributions is cold therapy, which treats pathological narcissism as a form of complex post-traumatic stress disorder. This therapy involves re-traumatization and reframing to help victims process their trauma and develop healthier coping mechanisms. By recognizing the parallels between complex post-traumatic stress disorder and the experiences of those subjected to narcissistic abuse, therapists can better tailor their interventions to support recovery. Broader implications. Vaknin's work has broader implications for understanding the impact of emotional and psychological abuse in various contexts, including intimate relationships, family dynamics, and workplace environments. His theories underscore the necessity of recognizing and addressing the subtle yet devastating effects of narcissistic abuse, advocating for greater awareness and support for victims. In conclusion, Sam Vaknin's pioneering work on the relationship between narcissistic abuse and complex post-traumatic stress disorder has profoundly influenced the understanding of emotional and psychological trauma. By highlighting the severe and lasting impact of narcissistic abuse, Vaknin has not only advanced psychological theory, but also provided valuable insights into the treatment and recovery of its victims. His contributions continue to resonate in the fields of psychology and mental health, offering hope and guidance to those affected by this insidious form of abuse. Cold therapy, a novel approach to treating pathological narcissism. Sam Vaknin's introduction of cold therapy represents a significant advancement in the treatment of narcissistic personality disorder and related psychological conditions. By conceptualizing pathological narcissism as a form of complex post-traumatic stress disorder, Vaknin developed a therapeutic approach that addresses the deep-seated trauma and emotional dysfunctions underlying narcissistic behavior. This essay explores the principles, techniques, and impacts of cold therapy, highlighting its innovative contributions to the field of mental health. Conceptual foundations of cold therapy. Cold therapy is built on the premise that pathological narcissism is not merely a personality disorder, but a manifestation of complex trauma. According to Vaknin, narcissists exhibit symptoms of arrested development and emotional dysregulation due to early life trauma and abuse. This perspective shifts the focus from the narcissist's overt behaviors to the underlying psychological wounds that drive these behaviors. Vaknin argues that narcissistic traits, such as the need for admiration and lack of empathy, are defense mechanisms developed to cope with unresolved trauma. By reframing narcissism as an adaptive response to early trauma, cold therapy aims to uncover and address these deep-rooted issues, fostering genuine emotional healing. Key techniques in cold therapy. Cold therapy employs several unique techniques designed to re-traumatize and reframe the patient's experiences. These techniques are intended to break through the narcissist's defensive barriers and facilitate emotional processing and growth. Key components of cold therapy include re-traumatization. This controversial technique involves exposing the patient to controlled scenarios that evoke past traumas. The goal is to reawaken buried emotions and memories, allowing the patient to confront and process them in a therapeutic setting. This process helps dismantle the narcissist's defense mechanisms and promotes emotional release. Reframing involves changing the patient's perspective on their past experiences and current behaviors. By helping patients reinterpret their traumatic memories and understand their narcissistic traits as survival strategies, therapists can guide them towards healthier ways of coping and relating to others. Attachment work. Cold therapy emphasizes the importance of addressing dysfunctional attachment styles. By exploring the patient's early relationships and attachment patterns, therapists can identify the origins of their emotional dysregulation and work towards building more secure and healthy attachments. Emotional regulation. Developing emotional regulation skills is a crucial aspect of cold therapy. Patients learn to identify, understand, and manage their emotions effectively, reducing their reliance on narcissistic defenses and improving their overall emotional well-being. Impact and efficacy of cold therapy. Cold therapy has shown promise in treating individuals with pathological narcissism, offering a novel approach that goes beyond traditional therapeutic methods. By addressing the root causes of narcissistic behavior, this therapy aims to achieve lasting change rather than merely managing symptoms. Studies and clinical observations suggest that cold therapy can lead to significant improvements in emotional regulation, empathy, and interpersonal relationships among narcissistic patients. By facilitating the processing of unresolved trauma, patients can develop a more integrated and authentic sense of self, reducing their dependence on narcissistic defenses. Challenges and controversies. Despite its potential benefits, cold therapy is not without its challenges and controversies. The re-traumatization technique, in particular, has raised ethical concerns due to the risk of exacerbating the patient's distress. Critics argue that exposing patients to traumatic scenarios may do more harm than good if not managed carefully. Proponents of cold therapy, however, emphasize the importance of a controlled and supportive therapeutic environment to mitigate these risks. Additionally, the efficacy of cold therapy varies among individuals, with some patients responding more positively than others. This variability highlights the need for further research and refinement of the approach to enhance its effectiveness and safety. Conclusion. Sam Vaknin's cold therapy represents a groundbreaking approach to treating pathological narcissism by addressing its roots in early life trauma and complex trauma. Through techniques such as re-traumatization and reframing, cold therapy aims to dismantle narcissistic defenses and promote genuine emotional healing. While the approach has shown promise, it also presents ethical and practical challenges that require careful consideration. Nonetheless, cold therapy offers a valuable framework for understanding and treating the complex interplay between narcissism and trauma, paving the way for more effective and compassionate interventions in the field of mental health. The dual mothership concept analyzing Sam Vaknin's profound insight. Sam Vaknin, a prominent figure in the study of narcissistic personality disorder, has introduced numerous groundbreaking concepts to better understand the dynamics of narcissistic relationships. One of his most profound insights is the dual mothership concept. This idea explores the complex relational dynamics between narcissists and their intimate partners, shedding light on how both parties recreate and reenact early childhood attachment patterns. Understanding the dual mothership concept. The dual mothership concept posits that both the narcissist and their partner unconsciously view each other as idealized maternal figures within a shared fantasy. This dynamic stems from unresolved childhood attachment issues and manifests in their adult relationships. Vaknin suggests that this reenactment of early childhood dynamics creates a dysfunctional but deeply interconnected relationship where both individuals attempt to fulfill unmet childhood needs. Narcissistic dynamics and childhood attachment. At the core of Vaknin's dual mothership concept is the idea that narcissists and their partners are driven by unresolved childhood traumas and unmet attachment needs. Narcissists typically experience disrupted or inadequate attachments during their formative years, leading to emotional dysregulation and an insatiable need for validation and admiration in adulthood. Their partners often have similar unresolved issues, seeking out relationships with narcissists in an unconscious attempt to heal their own childhood wounds. In this context, the narcissist and their partner engage in a mutual fantasy where each person serves as a substitute for the nurturing, idealized maternal figure they both lacked in childhood. This dynamic leads to a cyclical pattern of idealization and devaluation as both parties project their unmet needs and expectations onto each other. Mechanisms of the dual mothership dynamic. Idealization. In the initial stages of the relationship, both the narcissist and their partner idealize each other, viewing their counterpart as the perfect caretaker or provider. This idealization creates a sense of euphoria and fulfillment, as both individuals temporarily feel that their deep-seated emotional needs are being met. Projection. As the relationship progresses, both parties begin to project their unresolved childhood traumas and unmet needs onto each other. The narcissist projects their need for unconditional admiration and validation, while their partner projects their need for stability and nurturing. Devaluation. Inevitably, neither party can fulfill the unrealistic expectations placed upon them. This leads to feelings of disappointment and frustration, resulting in a phase of devaluation. The narcissist becomes critical and dismissive of their partner, while the partner feels increasingly neglected and invalidated. Reenactment. Despite the pain and dysfunction, both parties remain trapped in this cyclical pattern due to their unconscious need to reenact and potentially resolve their early childhood dynamics. This reenactment perpetuates the relationship, often leading to prolonged emotional turmoil and psychological distress. Implications of the dual mothership concept. Vaknin's dual mothership concept has significant implications for understanding and treating narcissistic relationships. By recognizing the underlying attachment issues and mutual projections at play, therapists can better address the root causes of the dysfunction. This understanding can facilitate more effective therapeutic interventions aimed at breaking the cycle of idealization and devaluation. Therapeutic interventions. Therapy can focus on helping both parties recognize and process their unresolved childhood traumas. By fostering awareness and promoting emotional healing, therapists can guide individuals towards healthier relational patterns and more realistic expectations. Personal growth. For individuals in narcissistic relationships, understanding the dual mothership dynamic can be a crucial step towards personal growth and recovery. By acknowledging their own unresolved issues and the ways in which they contribute to the relationship's dysfunction, individuals can work towards developing healthier self-perceptions and more balanced relationships. Educational awareness. Vaknin's concept also underscores the importance of educational awareness in preventing and addressing narcissistic abuse. By educating the public about the dynamics of narcissistic relationships and the impact of unresolved childhood trauma, society can better support individuals in recognizing and escaping these toxic patterns. Conclusion. Sam Vaknin's dual mothership concept provides a profound insight into the intricate dynamics of narcissistic relationships. By framing these relationships as mutual reenactments of early childhood attachment issues, Vaknin offers a compelling explanation for the cyclical patterns of idealization and evaluation that characterize these relationships. This understanding paves the way for more effective therapeutic interventions and personal growth, ultimately contributing to a deeper comprehension of narcissistic personality disorder and its impact on intimate relationships. Narcissism as an addiction, analyzing Sam Vaknin's profound insight. Sam Vaknin's conceptualization of narcissism as an addiction provides a revolutionary framework for understanding narcissistic personality disorder, NPD. This perspective shifts the focus from viewing narcissism merely as a set of personality traits to recognizing it as an addictive behavior. By framing narcissism in this way, Vaknin highlights the compulsive nature of narcissists' need for validation and admiration, drawing parallels to substance addiction. This essay explores the implications of this insight, the mechanisms involved, and its impact on therapeutic approaches. Understanding narcissism as an addiction. Vaknin's insight into narcissism as an addiction is grounded in the idea that narcissists are addicted to narcissistic supply, the constant need for attention, validation, and admiration from others. Just as addicts depend on their substance of choice to regulate their emotions and achieve a sense of euphoria, narcissists rely on external validation to maintain their fragile self-esteem and sense of identity. The addictive nature of narcissism manifests in several ways. Compulsive behavior. Narcissists exhibit compulsive behaviors aimed at securing narcissistic supply. These behaviors can include manipulation, deceit, and exploitation of others to obtain the attention and admiration they crave. Tolerance and escalation. Similar to substance addiction, narcissists often develop a tolerance to their sources of narcissistic supply. Over time, they require increasingly greater amounts of attention and validation to achieve the same emotional effect, leading to escalating demands on their relationships. Withdrawal symptoms. When deprived of narcissistic supply, narcissists experience withdrawal-like symptoms, including depression, rage, and a profound sense of emptiness. These symptoms drive them to seek out new sources of validation, perpetuating the cycle of addiction. Mechanisms of narcissistic addiction. Vaknin's theory identifies several key mechanisms that underpin the addictive nature of narcissism. Emotional regulation. Narcissists use external validation as a primary means of regulating their emotions. The approval and admiration of others provide a temporary boost to their self-esteem, masking their underlying feelings of inadequacy and insecurity. Identity construction. Narcissists construct their identities based on the reflections and feedback of others. This externalized sense of self makes them highly dependent on others' perceptions to maintain a coherent and positive self-image. reward system activation. The pursuit and attainment of narcissistic supply activate the brain's reward system, releasing dopamine and creating a sense of pleasure and reinforcement. This neurobiological response further entrenches the addictive cycle as narcissists become conditioned to seek out these rewarding experiences. Implications for treatment. Vaknin's conceptualization of narcissism as an addiction has significant implications for the treatment of NPD. Traditional therapeutic approaches often focus on addressing the overt behaviors and traits associated with narcissism. However, understanding narcissism as an addiction necessitates a different approach that targets the underlying compulsive need for validation and admiration. Addiction treatment models. Incorporating addiction treatment models into therapy for narcissists can be beneficial. This includes techniques such as cognitive behavioral therapy to address the compulsive behaviors and thought patterns associated with the pursuit of narcissistic supply. Developing internal validation. Therapists can work with narcissists to help them develop internal sources of validation and self-esteem. This involves fostering self-compassion, self-awareness, and a more stable and integrated sense of self that is less dependent on external approval. Addressing withdrawal symptoms. Understanding the withdrawal-like symptoms that narcissists experience when deprived of narcissistic supply can help therapists support patients through these challenging periods. This may include developing coping strategies and emotional regulation techniques to manage feelings of emptiness and despair. Broader societal impact. Vaknin's insight into narcissism as an addiction also has broader societal implications. It highlights the pervasive nature of narcissistic behaviors in various social and professional contexts, including social media, corporate environments, and leadership roles. Recognizing these behaviors as addictive can lead to more effective strategies for managing and mitigating their impact on individuals and organizations. Social media addiction. The rise of social media has amplified opportunities for narcissistic supply, with platforms offering constant validation through likes, comments, and followers. Understanding this dynamic as an addiction can inform healthier social media use and digital well-being initiatives. Leadership and workplace dynamics. In professional settings, recognizing narcissistic behaviors as addictive can lead to more effective management and organizational strategies. This includes promoting ethical leadership, fostering collaborative environments, and addressing toxic behaviors that stem from narcissistic addiction. Conclusion. Sam Vaknin's conceptualization of narcissism as an addiction provides a profound and transformative framework for understanding and treating narcissistic personality disorder. By highlighting the compulsive nature of the need for validation and admiration, Vaknin's insight offers a deeper understanding of the mechanisms driving narcissistic behavior. This perspective not only informs more effective therapeutic approaches, but also underscores the broader societal implications of narcissistic addiction. As we continue to explore and address the complexities of narcissism, Vaknin's contributions remain invaluable in guiding both clinical practice and societal awareness. Pathological narcissism and societal impact. Analyzing Sam Vaknin's profound insight. Sam Vaknin's exploration of pathological narcissism extends beyond individual psychology to encompass its broader societal implications. His insight that pathological narcissists disproportionately occupy influential positions in society, such as in medicine, finance, and politics, has profound implications for understanding the dynamics of power, leadership, and social norms. This essay delves into Vaknin's theories on the societal impact of pathological narcissism, examining how these individuals shape and are shaped by the environments they dominate. The narcissistic personality in positions of power. Vaknin posits that pathological narcissists are particularly drawn to positions of power and influence. Their traits, grandiosity, entitlement, lack of empathy, and a relentless drive for admiration align well with the demands and rewards of high-status roles. In positions of power, narcissists can secure a constant stream of narcissistic supply, reinforcing their self-worth and status. Influence in medicine. In the medical field, narcissists may gravitate towards roles that provide prestige and authority, such as surgeons or high-ranking administrators. Their confidence and decisiveness can be assets in these roles, but their lack of empathy and ethical considerations can lead to problematic behaviors, such as prioritizing personal gain over patient care or engaging in exploitive practices. Impact in finance. In the finance sector, narcissistic traits can drive individuals to take excessive risks and engage in unethical practices to achieve wealth and recognition. The 2008 financial crisis, for example, has been partially attributed to the actions of highly narcissistic leaders who prioritized short-term gains over long-term stability. Vaknin's theories suggest that such individuals contribute to a culture of greed and instability, exacerbating economic disparities and undermining public trust. Insight publishing. Dominance in politics. Politics is another arena where pathological narcissists can thrive. Their charisma, assertiveness, and ability to manipulate public perception make them effective campaigners and leaders. However, their self-serving nature and disregard for democratic principles can lead to corruption, authoritarianism, and policies that favor their interests over the public good. Historical and contemporary examples of narcissistic leaders illustrate the dangers of unchecked narcissism in governance, societal norms, and collective narcissism. Vaknin also introduces the concept of collective narcissism, where societal values and norms increasingly reflect narcissistic traits. In a culture that celebrates individualism, materialism, and superficial success, narcissistic behaviors are often rewarded and emulated. This cultural shift can create an environment where narcissistic traits are not only tolerated but encouraged, leading to a vicious cycle of narcissistic reinforcement. Media and celebrity culture. The media and entertainment industries play a significant role in promoting narcissistic values. Celebrity culture, reality TV, and social media platforms often glorify narcissistic behaviors, presenting them as desirable and aspirational. This pervasive influence shapes public attitudes, especially among younger generations, who may internalize these values and prioritize personal branding and self-promotion over genuine connections and community-oriented values. Insight publishing. Corporate culture. In the corporate world, narcissistic traits can be mistaken for leadership qualities. The emphasis on competitiveness, personal achievement, and profit maximization often rewards those who exhibit narcissistic behaviors. This can lead to toxic work environments, unethical business practices, and a focus on short-term gains at the expense of long-term sustainability and employee well-being. Wikipedia, Insight Publishing. Implications for society. Vaknin's insights into the societal impact of pathological narcissism highlight several critical implications. Erosion of trust. The prevalence of narcissistic leaders and cultural norms can erode public trust in institutions. When leaders prioritize personal gain over the common good, It undermines confidence in governance, finance, and other critical sectors. Social fragmentation. A society that values individualism and self-promotion over collective well-being can become increasingly fragmented. This can lead to social isolation, reduced civic engagement, and weakened community bonds. Ethical decline. The normalization of narcissistic behaviors can result in a decline in ethical standards. As narcissistic traits are rewarded and emulated, unethical practices may become more widespread and accepted. Mental health impact. The pressure to conform to narcissistic norms can have adverse effects on individual mental health. The constant pursuit of validation and success can lead to stress, anxiety, and a sense of inadequacy among those who feel they cannot measure up. Addressing the impact. To mitigate the societal impact of pathological narcissism, it is essential to promote values and behaviors that counteract narcissistic tendencies. This includes promoting empathy and altruism, encouraging empathy, community service, and altruistic behavior can help shift societal values away from narcissism and towards collective well-being. Ethical leadership. Fostering ethical leadership practices and holding leaders accountable can help ensure that positions of power are occupied by individuals who prioritize the common good over personal gain. Media responsibility. The media can play a crucial role by promoting positive role models and ethical behaviors rather than glorifying narcissistic traits. Education and awareness. Raising awareness about the dangers of narcissistic behaviors and educating individuals on healthy relationship dynamics and self-esteem can help build a more resilient and empathetic society. Conclusion. Sam Vaknin's exploration of pathological narcissism and its societal impact provides a crucial framework for understanding how individual traits can shape and be shaped by broader social dynamics. By recognizing the pervasive influence of narcissistic behaviors in positions of power and cultural norms, we can develop strategies to promote healthier, more ethical, and more connected societies. Vaknin's insights remind us of the importance of empathy, ethical leadership, and community-oriented values in countering the adverse effects of pathological narcissism. Closing summary. The 5 key insights of Sam Vaknin on narcissism and its impact. Sam Vaknin's work on narcissistic personality disorder has provided profound insights into understanding the intricacies of narcissistic behavior and its wider implications. His theories encompass the psychological mechanisms behind narcissism, the dynamics within narcissistic relationships, and the societal impact of narcissistic individuals. Here, we summarize the 5 key insights from his extensive body of work. 1. Narcissistic abuse and complex post-traumatic stress disorder. Vaknin was one of the first to draw a direct connection between narcissistic abuse and complex post-traumatic stress disorder. He posited that the prolonged emotional and psychological manipulation experienced in relationships with narcissists can lead to severe chronic trauma. Victims of narcissistic abuse often exhibit symptoms of complex trauma, such as emotional dysregulation, negative self-perception, and difficulties in relationship. This insight has significantly influenced therapeutic approaches, highlighting the need for trauma-informed care in treating survivors of narcissistic abuse. 2. Cold therapy. Cold therapy, developed by Vaknin, addresses pathological narcissism by framing it as a form of complex trauma. This therapeutic approach involves techniques such as re-traumatization and reframing, aiming to dismantle the narcissist's defense mechanisms and facilitate emotional healing. By focusing on the underlying trauma and emotional dysregulation, cold therapy seeks to foster genuine self-awareness and healthier relational patterns in individuals with NPD. 3. Dual Mothership Concept. The dual mothership concept introduced by Vaknin explains the mutual dependency between narcissists and their partners. Both parties unconsciously view each other as idealized maternal figures, reenacting early childhood attachment dynamics. This insight sheds light on the cyclical pattern of idealization and devaluation that characterizes narcissistic relationships. Understanding this dynamic is crucial for developing therapeutic interventions that address the root causes of relational dysfunction and promote healthier interactions. 4. Narcissism as an addiction. Vaknin's conceptualization of narcissism as an addiction provides a novel framework for understanding NPD. He likens the narcissist's need for validation and admiration to a substance addiction, driven by compulsive behaviors and a neurobiological reward system. This perspective underscores the importance of treating narcissistic behaviors as addictive patterns, focusing on developing internal sources of validation and emotional regulation skills to break the cycle of dependency on external approval. 5. Pathological narcissism and societal impact. Vaknin's insight into the societal impact of pathological narcissism highlights how narcissists often occupy influential positions in sectors such as medicine, finance, and politics. Their traits, grandiosity, entitlement, and lack of empathy can lead to unethical behaviors and systemic issues. Vaknin's theory of collective narcissism further explains how societal values and norms can reflect and reinforce narcissistic behaviors. Addressing these dynamics involves promoting ethical leadership, empathy, and community-oriented values to counteract the adverse effects of narcissistic influence. Conclusion. Sam Vaknin's contributions to the understanding of narcissism have been groundbreaking, offering deep insights into the psychological, relational, and societal aspects of NPD. By framing narcissism in terms of trauma, addiction, and social impact, Vaknin provides a comprehensive framework that informs both clinical practice and societal awareness. His work underscores the importance of addressing the root causes of narcissistic behaviors and fostering healthier, more ethical, and empathetic interactions at both individual and collective levels. Through continued exploration and application of these insights, we can better support individuals affected by narcissistic abuse and mitigate the broader societal impacts of pathological narcissism.